Coronavirus.
And companies are having to come up with ways for people to do those tests at home. And this morning, we're hearing from a local resident about her family's experience with home antibody tests.
JUMMY OLABANJI joins us once again with more on this story. JUMMY, good morning.
On air, good morning to you. You know, before this entire pandemic started, so many people traveled back and forth between D.C. and New York City, and that's what one Fairfax resident did for her job. She never knew, though, her last trip to New York would be right before this pandemic.
Fairfax resident Marissa Turner Potts often travels to New York City for work. In fact, on March 5th, she was on the Today Show Plaza with NBC's Craig Melvin and the Colorectal Cancer Alliance. Just a week after these photos were taken, the city that never sleeps was put to bed.
I was in the hotbed of where everything was starting to unfold.
New York soon exploded as the epicenter of the virus.
When I got back from New York, my husband was having this really bad cough and feeling just off.
Her husband eventually recovered, but as the COVID-19 pandemic spread across the country, Marissa couldn't shake the feeling that maybe her husband had contracted the virus. So last week, when her doctor's office began offering patients the ability to be tested for the COVID-19 antibody, she paid for at-home testing for her family of 3.
Patients are given a pinprick test where they can do it at home and send it back to the lab, and then we get the results back in about 48 hours, and I can call the patient.
The family's doctor, Jennifer Sims of Blue Sky Health and Wellness, says several of her patients have asked for antibody testing, but so far, all of them who have taken the test, including the Potts family, have tested negative for antibodies.
We're running IgM and IgG testing. So one tells us if you've had recent exposure, and other part of the test tells you if you've actually had antibodies because you've had an exposure, and that your body's actually starting to create an immune response, a long-term immune response.
Dr. Sims says you should talk to your doctor about the antibody test only if you've had direct contact with someone like a coworker or family member who's tested positive for the virus.
If you feel that you possibly have been exposed, give it a few weeks before you do an antibody test. Antibodies don't necessarily show up instantly.
We need to continue to stay the course and practice our safe distancing and to still be quarantined because, as we know, this is not over.
Now, as Dr. Sims pointed out, it's important to note that these antibody tests are still new. We all know that. So even if you do test negative, it's possible you could test positive for those antibodies later on, because for some people and patients, it takes weeks for those antibodies to show up. But of course, you should check in with your doctor before you sign up for any sort of testing with coronavirus. Back over to you.
Yeah, for sure. Glad Marissa and her family are doing well. JUMMY, thank you.
6:16 right now, and this pandemic is canceling another major event in our region for the first time since World War II. The annual Chincoteague Island Pony Swim